good morning, and thank you for joining us today for our presentation. So we'd like to give a little bit of background on the Rutgers School of Health Professions. And the SHP, the School of Health Professionals, is part of Rutgers Biomedical Health Sciences, and our programs are located in Newark, Piscataway, and Camden, New Jersey. And this is a nice picture of our building in Newark. The degrees granted at SHP range from undergraduate to graduate level and include such areas as physician assistant, physical therapy, clinical nutrition, occupational therapy, speech language, pathology, rehabilitation, counseling, health informatics, clinical lab sciences, and many more. So we are training health professionals who will be working directly with clients and patients in a variety of settings. And in 2018, by College Factual, we were ranked #1 in best colleges to study health professions. So what we're going to do now is just take a quick poll. We have 3 questions. Question 1 is, what is your current academic responsibility? Do you utilize online learning programs for clinical skills training? And have you adapted any hands-on activities to online or virtual learning? So you will find these polls if you go to the session tab, click on the polls tab, and you'll see the 3 questions listed there. Once you indicate your answer, please be sure to hit submit response, and that will tally up everyone's answer. So we'll give you a couple of minutes to do so.
Okay, so let's take a look at our audience. So we have, it looks like a few folks from secondary education, a couple of those of you that are teaching at graduate level, and 9 in the health professions, which is great. And some of you would indicate other, which is great. So all of us are educators, which is really the point, because we're trying to teach students in different ways and different things. So it's just good to know what your background is, and please let us know how we can maybe direct some of the questions to your particular population that you teach. Do you utilize online learning programs for clinical skills training? So things like physical exam, interviewing, and counseling. So 68% of you say yes, 30% or so say no, which is fine. And that's, again, depending on what you're teaching, that may not be applicable to you. And have you adapted any hands-on activities to online virtual learning? And 81% of you have said yes, 23 or 24% had no. So quite a large majority of you have been challenged to shift on what normally would be hands-on training to virtual. And so hopefully what we're going to show you today might help either validate some of the decision, the techniques that you've made, or maybe perhaps give you some other ideas. So thank you for participating in our poll so we can know a little bit more about you.
Great, thank you. Okay, so the session today is going to provide some insight to educators who are challenged with teaching healthcare students competency-based education or clinical skills using the online platform. And so it's nice to see that we had about 80% or so that are using it already. So hopefully this will help. And if not, this may lead the other participants to maybe adopt it. So we'll see. So the first objective is that we want to identify strategies for clinical skills training for nutrition practitioners while using online learning platforms. So we want to really give clinical skill instruction, such as interviewing, counseling, physical assessment. So we'll be going through that in this presentation. Next, we will identify learning strategies for clinical skills evaluation for nutrition practitioners while using online learning platforms, such as like the flipped classroom, which we'll learn about. And then lastly, we're going to identify learning tools and online learning that will foster clinical skills training. So we have some formative and summative evaluations. We have a TOSCI, OSCE, which we're going to learn about. And so these will also be explained throughout our session. So for the basis of this presentation, we wanted to define what we mean when we are saying clinical skills. So in our area of practice, which is nutrition sciences, we are training our students in a variety of skills prior to their daily interactions with patients in certain settings such as acute care, long-term care, the community, pediatrics, ambulatory care centers, athletics, and many more areas. So we are a profession that can be found in multiple arenas. So looking at nutrition focused physical exam, the NFPE, this is a head to toe physical exam that will focus on the nutrition status, looking for things like malnutrition, muscle or fat wasting, intra and extra oral examinations, any signs of dysphagia, which is swallowing difficulty, as well as any sensory changes related to chewing, biting, and eating. Then, as in clinical screening and assessment, as health professionals, we have a process of assessment, which includes screening. And we assess individuals for conditions such as, again, malnutrition or other nutritional problems. And we look at data such as anthropometrics, biochemistry, weight, food history, medical history. And we've also included screening for blood pressure and blood glucose point of care. Next, also, we look at interviewing and history taking. So we want to have skills specifically for taking a patient's history. So they're trained on client-centered communication to assure that they are gaining the best information and thorough history from patients and clients. And then next, education and counseling. So students are being trained on how to provide evidence-based, accurate, patient-centered education and counseling through approaches like motivational interviewing, trauma-informed care, and cultural sensitivity. And lastly, we look at the interpersonal skills and communication, and we're evaluating them on their professionalism, how they interact with each other, with other professionals, and mostly seen with our virtual and interprofessional activities. So throughout this presentation, these are the strategies and will be detailed in length for training and evaluation using the online platform.
Great, thank you. So, with what I'm going to go through next is just a description of some of those strategies of training and evaluation. And part of this discussion will show you a couple of video clips of these particular training tools. So with the use of a virtual platform, we have implemented learning strategies that have targeted these clinical skills training that Patrice just reviewed. So for this presentation, I just wanted to highlight a few. First of all, we use simulation, and simulation can range in fidelity, meaning how realistic it would be in real life. So some forms of simulation we use would be role playing, so peer to peer. It can be student to family member or faculty to student. We will use breakout rooms in our classroom and to facilitate that activity. We also use a virtual mock electronic health record called EHR Go, which we'll be showing you a demo of that very shortly. But this allows students to practice navigation. It helps them practice data collection for their assessment, and also use when we want to develop mock experiences between them and their preceptor. So we'll again show you a snippet of that in a few minutes. We also utilize simulation for students to practice their nutrition-focused physical examination skills. So they will be utilizing their either, again, practicing with themselves, with the faculty, or with their peers, and that way we can, and through recording, they can evaluate them as well. So we'll be referring to our strategies of nutrition-focused physical examination throughout, which includes the TOSCI and the OSCI. And this is the TOSCI is a teaching, objective, structured, clinical examination. It can either be a teaching one or a non-teaching one. The OSCE is basically what we would consider the final exam of the student. But I'm going to go through in more detail about what those are. But this is a higher fidelity simulation that utilizes a standardized patient or a patient actor, and the student will move through a session as if it would be real life. We use the teaching OSCE for training and then the OSCE for the evaluation. And like I said, I'm going to go through it a little bit more detailed. Another strategy we use for clinical skills training is our flipped classroom. This is a weekly, what we do is the flipped classroom is a method of learning that takes the traditional classroom and approach and flips it. So the students will receive tasks and activities to complete prior to class. And then it allows them for some practical application. We use role playing or breakout rooms. We have some simulation-based learning during a live weekly face-to-face class. And then we would have a post-class activity so that they're reinforcing some of the knowledge through a more summative evaluation, for example. The style of teaching is very effective in promoting critical thinking skills and utilizes a lot of different active learning styles. So it's a great way to teach. And it also fits right in when we're looking at those clinical skills. Another strategy that we use is clinical mentoring. And these are virtual check-ins, as we call it. So when our students are in practice training, so our program, just so that you know, have a little bit of background, has a didactic portion where they are in classroom online learning for a full semester and a full semester and a half or so. And then they go into their supervised practice experiential learning when they are in their clinical rotations. And that will be a face-to-face, obviously, experience when they're with a preceptor at a clinical site. And I may refer to those experiences as clerkships as we go through this. But so we have a time when the students are in their clinical rotations, and that's when, obviously, where they're learning most of their hands-on clinical skills. So we want to make sure we're present in that experience with them at some point. So we do the clinical check-ins and either weekly or bi-weekly. And this is a way that we can meet with them either in person or virtually and kind of meet them where they're at, maybe probe a little bit on what they're learning, ask them what type of patient did they see that morning, and then we sort of mentor them through it. And finally, another strategy we have is the use of a workshop, and we have three-day workshops that we have conducted virtually, but obviously, depending on the availability, we ideally like it to be in person. So we do have in-person workshops, but we have conducted these workshops virtually as well. And these are where students are gaining concentrated training for skills of assessment, physical examination, professionalism, interviewing and counseling. We do a lot of, we're going to be doing a lot of DEI training. Our workshop actually begins tomorrow for our current cohort, interprofessional collaboration and research. So we are able to do a concentrated time frame of training for the students. And this is happening, again, either virtually or we can do it in person. Okay, so the next thing we wanted to do is just show you some of these strategies in action. So we have an example of a breakout room where the faculty member is evaluating and providing feedback on a student's NFPE practice with a family member. So the peer feedback is also provided. And so this is a model of what the student will do in person or virtually. And it's similar, something that's one of the practices that they're doing the NFPE is part of what we do in the TOSCE and OSCE. So we're just going to show you a segment of this assessment or this of this step, and Patrice is going to take us through that.
Okie dokie. Hi, Miss Hollander. It's nice to meet you. Nice to meet you. How are you doing today? today?
I'm doing good. How about you?
I'm doing good. My name is Mason. I'm going to be conducting a nutrition-focused physical exam and assessment on you today. I'm basically just going to start by asking some questions, then do a physical exam starting from your head all the way down to your toes and looking a little bit in your mouth. How does that sound?
Sounds good.
Okay, so let's start with the questions. Can you just state your full name for me?
Valerie Helena,
Great. And where are we right now?
Albuquerque, New Mexico.
Great. And what is the month and year?
December 2021.
Great, thank you. So are you using any prescription medications, any over-the-counters or supplements?
No.
No. Have you had any problems experiencing dry mouth?
No.
Can you finish a meal or snack without a drink?
Yes.
Okay, great. And then have you experienced any changes in your taste recently?
No, ma'am.
How about, do you experience oral pain when you're eating?
No.
Okay. And then how about biting, chewing, and swallowing? Any issues there?
All's good.
No, great. Now we'll start with the physical exam. I'm just gonna put some gloves on. First thing, your hands really quick. So if you can make an okay sign with your thumb and your index finger for me, please. Palpate the interosseous space right here. Go. The same with the other side too. Thank you. Now can you make a 90-degree angle with your arm like this? Palpate the bicep as well as the tricep. And the same up. Slow here. I'm going to start by palpating your patellar region, both sides, as well as your anterior thigh. And looks good there. Now for your calf muscles. Everything looks good there. Can you point your toes for me and I'll just do the same thing? Perfect. Thank you. Okay, can go ahead and take your feet off of that. So while I was doing that, I didn't notice any edema or any signs of dehydration. Your hair looks good. I didn't notice any abnormalities. Can I just take a look at your nails?
Okay, great. So that was just an example of the NFPE assessment. So as you can see, we gave the opportunity for the faculty who was in that group to evaluate or to take a look and see and provide feedback, as well as the peers can provide feedback as well. And again, that's just one of the steps of the, as I mentioned, the TOSCI and the OSCE that I'll talk about in a few minutes. So the next video that we wanted to show you, as I mentioned before, the use of electronic health record is pivotal when working in healthcare. EHR Go is a simulated electronic health record, which allows students to navigate a mock client, pull data up for assessment that we would want them to identify in order to create the nutrition assessment. So the labs, the anthropometrics, any particular kinds of testing, and even reports from other health professionals like physician reports, nurse reports, lab reports, pharmacy reports. Anyway, this technology has been an excellent tool for training, and as you're going to see with this short video, it allows the student to be exposed to a variety of type of patients. So we can choose based on what kind of patient we want them to learn about, and also those that might have different settings, patients in different settings and social challenges. So we're going to share with you a little snapshot of the EHR Go video.
EHR Go has revolutionized educational EHRs and experiential education. Go was built from almost 2 decades of experience.
Grammarly does more than catch errors.
Sorry about this.
It's okay.
You can
Designing and teaching with educational EHRs. We know what works and what doesn't. EHR Go works. It makes teaching fun and learning easy, or teaching easy and learning fun. Let us show you how. First, some basics. EHR Go is web-based. In this demo, you'll see Go used in Firefox, but any different browser works with Go on any different kind of computer. Users can also use their tablets. It's a beautiful mobile tablet experience with a great touchscreen. Go is used widely by hundreds of colleges and universities at all levels and in every different type of healthcare professional program in the United States and Canada. You are seeing Go interprofessionally today, not specifically for any one discipline. EHR Go is an experiential, case-based teaching learning platform. Go library to easily find the content I want. For your convenience, the realistic Go cases are all organized via clinical site. The community library can be used to find cases of any type, from hospitalized, medical, surgical, or critical care patients to primary care or home care clients, or even psychiatric or community pharmacy cases. Finally, EHR Go cases in the classroom and for clinical preparation, use Go to assign patient cases that deliver realistic, diverse, and interprofessional clinical application of the concepts being covered. With a Go case, students can review evidence-based case resources as they explore and review the patient's interactive clinical history, health history, progress notes, problems, medications, microbiology, and lab results. Help the student put together the clinical pieces and form a plan of care. The case includes a library of relevant evidence-based practice resources to help them analyze, plan, and understand the whole clinical practice. Sound familiar? It should, because in EHR Go, the student is practicing the same clinical review skills you want them to use in actual clinical practice. It's a short leap from the classroom and case review use of Go to the practice and simulation lab. In the lab, bring the Go patient to life with skills, training, and
Okay, excellent. Thank you, Patrice, for pulling that up. So that was just a really great insight to EHR Go. As I mentioned before, we use that for sometimes in our classroom as well. And so the flipped classroom, which is the next strategy I was just going to briefly draw upon, is what we use in our learning management system, which we use Canvas. If you're at Rutgers, you all are. So this is where we're housing all of our didactic material for the coursework and clinical training. But you can see here how we use to organize the flipped classroom into 3 sections. So the flipped classroom has a pre-live class activity. So these are where readings, videos, demonstrations regarding nutrition and immunity. In this particular I'm showing you a snapshot of the immune system, of diseases in the immune system, which is one of our medical nutrition therapy modules. So in this example, they might be reading focused content on nutrition and immunity. And they will also prepare, in this particular case, they prepare a research article review that we'll work on in the live session. And that's the second area, which is the live class session. So this is the live class. In this particular module, we had a guest speaker who worked with individuals with food allergies and sensitivities. And then we also had a breakout room that discussed their research article that they had to prepare. And the live session could also include role playing. It could include a case discussion, or we may use EHR Go. We might ask them to go see a patient, quote unquote, go see a patient and come back and tell us about it, like as if they would be reporting to a preceptor. And then we have post-live class activities. And this could be a way to finish up their learning, whether it's submitting an assignment, they could be working on a case study, or they have to work on something that may not be due that particular Sunday, but it could be, future, in a few weeks. So there's three points of learning that you can address with a flipped classroom, and really uses a lot of engagement and a lot of great learning activities to help with their training. Okay. All right, and then these are just 2 snapshots of our clinical mentoring that I had with 2 students. And again, this is just a virtual meetup where we would connect either after their workday, or sometimes we would I'll use their lunch breaks, and they'll share with me about an actual patient that they're working on, so we can talk through strategies. I can maybe challenge them. They can get back to me on I can evaluate some critical thinking. But it's a really important part of our training, is to have that faculty student mentoring that occurs. And just by the way, these are 2 students that were at West Palm VA during COVID-19. And I have to say, since we're in the spirit of virtual training. We have our clerkship experience is a total of about 9 months. They spent about 7.5 months of their clerkship training virtual. They literally worked with their preceptors, but through teleconferencing, through Teams, and they literally phoned into the hospital. They were able to talk to nurses as well as attend virtual rounds where they were brought in either with like an iPad or a laptop, and they could actually view into an ICU bedroom, an ICU room. And they also utilized their own kitchens. They able to create recipes, and they did some food demonstrations for patients in the hospital food service department. So anyway, I just wanted to kind of give you that little insight because we had to do some creative adapting during COVID, and these two were rock stars. They were really great, and they passed their RD exam. They're both RDs currently now, so that's always our goal, right? Okay, our next slide is next couple minutes I want to go through is just how we do evaluating the clinical skills. And as I mentioned before, we use the TOSCI, that objective structured clinical exam, for training, but we also use it to evaluate the student. And the next couple slides, I'm going to go over a little bit more of a visual of what we do there. But in addition to the TOSCI, we also use recordings. So many of the sessions of role playing or even just the assignments that we might give them to do at home or with peers, they record, and then we can view them to evaluate. And they can do that either using a tool that we'll talk about in a few minutes called VoiceThread or Zoom, of course. But we also have the students do a lot of self-evaluation. So part of a competency-based education program like ours requires a lot of self-reflection. And so students will complete a lot of their own formative evaluations on their competency and how they're building on those competencies in clerkship. And we will review them, or they review it with their preceptors. Role playing, we use, again, simulation can be used for training, but we can also use the simulation as a vehicle for evaluating the student as well. We also have students do live presentations, and that will give over Zoom that they can present to peers and faculty. They can do case studies, journal clubs, or whatever they may be assigned. And then again, formative and summative assessments evaluation is a big part of competency-based education. So we have a lot of opportunities for students to evaluate their skills. Literally, they're doing on a weekly basis, and we use a program called eValue that houses all the competencies, and they'll utilize that computer program to sort of categorize and sort of keep track of how they're completing their competencies. But then we meet with them 3 times throughout their experience with a summative experience. A summative evaluation will look at their progress and as a whole. And the next step. So some of the clinical skills that an OSCE or a TOSCI can be used to assess are listed here. And the opportunity for a student to practice in a setting where they're interacting with the patient, they're interacting with the patient actor, whether it be in person, and when we can do it in person, we utilize the clinical skills lab at the New Jersey Medical School. And it's fantastic technology. We can utilize that, but we've also adapted this to be done virtually as well. But for example, we mentioned the importance of students learning physical examination. So for them to be able to do this on a live patient actor is really good. And it allows them to, whereas if they were choosing, say, their parent or their husband or a peer that they're familiar with, to have them do a physical assessment on a stranger, and in this particular case, a patient actor, puts them at a point where they have to really think on their feet. They have to be, their acuity of their critical thinking has to be on point. And so this is a great way to practice the unpredictability so to speak, of working with particular patients. As many of us know, in health professions, you never know what you're going to get. But we also have the OSCE to evaluate their ability to conduct a patient history, and also how they initiate the education and counseling through observing their interactions with the patient. And then they can also practice their interpersonal skills and how are they developing the rapport, as well as navigate any challenges. For example, some of our patient actors may present as a patient with dementia, or a patient who's suffering some substance abuse, or maybe a patient who is non-compliant. And it gets them a way to get the nervousness out of their system, so that when they can navigate that challenge and then get the feedback, and then it gives them much more confidence as they start off their real life experience. So this is a picture of how we of what that TOSCE and OSCE would look like. On the left is, as you can see, is a group of observers. You have a faculty, which in the front there is Dr. Jane Ziegler in our department, and then a group of peers. And they are observing the student in the image to the right. He's in the next room. And so there's they actually can watch on a screen his actual physical exam and his interviewing and his counseling, and they're watching him as he goes through these steps. And then when he's done, he comes back into the room with his peers and faculty, and there's an immediate debrief, so that they are talking about things he did great, things that might have gone better. And then in addition, the patient actor, the standardized patient, comes in and also provides feedback saying, hey, I thought you did a really good job. You made me feel comfortable. We've had patient actors saying, you looked at your iPad the whole time. Didn't you realize that I was standing right there? So it's actually a really great feedback to get from the actor themselves. And then the OSCE, as I mentioned, this is when they do it on their own. So this is when there's no feedback right away. This is sort of their final exam. So they would go ahead and complete the whole examination as required. And really, it kind of pegs the Miller's, our Miller's pyramid of learning, assessment pyramid of clinical competence. It really targets the shows how, so that the student is showing us how they are able to do these steps in clinical skills. Okay, go to the next slide. We just added this slide to kind of give a little bit of like the logistics, because first of all, the TOSCE and OSCE is also about timing. It's time management of the student as well. They're evaluated on how they can show their skills, but also how they can navigate all what they need to do in a particular time frame. So if you're considering using an OSCE or a TOSCE in your curriculum, it's important to think about the total time it might take for just one student to complete the full evaluation. Especially if it's a TOSCE, you have to factor in the time of the debrief. So it's about 30 to 40 minutes per student. And then we have to multiply that by however many students we have in our cohort. So bottom line is, if you're going to do it virtually, you need 2 faculty for students, because one faculty needs to play the part of the standardized patient, and then another faculty will play the evaluator. But if you are if you're in person, you just need 1 faculty per room. But anyway, these are the logistics that has to be worked out to kind of determine, do you have the help that that's needed in order to perform these particular skill evaluations. And then we also wanted just to kind of highlight the benefits of this OSCE and the TOSCE. And it provides a format for educators to evaluate the clinical decision-making and problem-solving skills of the student. It also provides an assessment of the readiness of clinical practice and patient communication, interviewing, counseling, so that we can determine, do they need remediation before they begin their clerkship. As I mentioned before, the clinical skills lab at New Jersey Medical School is critical for the in-person OSCEs and TOSCEs, but we have been able to successfully move this type of evaluation virtually in 2020 and 2021. So this is an image of a student performing her final OSCE on her patient actor. We also were able to utilize students simulating a telehealth visit. So this image just shows how we use the clinical skills lab for as the patient actor on the left is looking at the laptop, who's conversing with one of our students on the right. And she's able to practice what a telehealth visit might appear to be. So this is another way that we can use virtual platforms to help with clinical training.
Okay, and as Jen had mentioned, the voice thread, and what this is a tool that we can use to help utilize the evaluation and assessment. So in this example, it's a patient's interview and an NFPE, where but we have used voice thread for purposes such as presentation and peer review projects. So the green bar at the bottom is a green timeline. So we can type in and record, we can record any types of comments, any types of evaluations, type or record. And then on the left bar here, it gives a icon, a little note will show up so that the student can go back and see this feedback. So again, we can do this for case studies, NFPEs, again, for faculty and student evaluations. So in summing up everything Jen and I have presented, these are the virtual tools that we use to foster the clinical skills training. So we use Zoom, we've seen for the NFPEs, for interviews, for our classrooms, our flipped classrooms. EHR Go, great platform for looking at diverse populations of patients, for case studies, really getting some practice into an electronic medical record. The breakout rooms are great within Zoom so that students can have the opportunity to lead. It's like a live classroom to talk amongst themselves, case studies, or work in groups. Voice thread that we have real live interactive feedback from faculty and students as well as for evaluation. And then the simulation, which we've talked about in terms of the TOSCE, the OSCE, role-playing, nutrition-focused physical exam. And then our learning management system is Canvas. So that's our platform that we use to guide the students for our pre, our live, and our post learning activities. So as we see a lot of, we had 80% of our participants today using online tools. So if you're looking to incorporate some of the tools or adopt some of the tools that we've just showcased today, these are some of the questions that you want to ask yourself or ask your staff if you're considering integrating some of these virtual skills training into your curriculum. So you want to ask, which courses can use a TOSCE or OSCE? Which course does best fit into your curriculum using the TOSCE, OSCE? And do you want to have more than one clinical skills exam to observe the skills progression over time? So we do one in the beginning of our student clerkship and then one at the end, which is the OSCE. So we do a teaching and we do an OSCE. We do two. Also training. Does your college or university have a clinical skills lab that you can use virtually with standardized patients? And will you be able to create the case study for each encounter, as Jen had mentioned? And technology. Will you be using your school's web platform with faculty as a standardized patient? And will the student have the technology needed to perform this? And lastly, do you have enough faculty to assist? As Jen had mentioned, if we have 25 students, we're breaking it down to at least 5 to 8 faculty that will assist in having each, kind of individualized session with the student.
And so finally, we just wanted to kind of leave you guys with what's the future of virtual skills, of skills training. And really what that leads us to is virtual reality, which I'm not I'm not a privy to yet, but I think if I had younger kids, possibly I would have one of those goggles in my house. But anyway, but virtual reality allows the user to manipulate computer generated real or artificial 3D environments in real time that can be used in applying practical knowledge in clinical practice. So commonly used now, we see it being used in nursing programs, medical schools, and for areas such as how to put on and utilize PPE, identification of anatomy, and refining surgical skills, general knowledge of topics such as anatomy. And also we are seeing it now on actual some procedural types of event things, such as if someone was going to learn how to intubate a patient who's in respiratory failure, or if we were going to have someone put in a feeding tube for a patient who can no longer eat on their own orally and they require nutrition support. So that's something as registered dietitians, our future registered dietitians can learn how to do. And so virtual reality is giving that skill a little bit more meat, like that skills training a little bit more meat. And so there was a nice systematic review done by Kaw and colleagues that looked at studies using VR in health professions training. And as compared to traditional learning, VR had a slight improvement in knowledge, and those studies that compared the level of digital activity had a higher increase in knowledge. So in addition to moderate and large improvements in skills using VR as compared to more basic digital formats. So by watching a YouTube on a dissection is going to be less effective than doing something in virtual reality on a particular dissection. So it's just a higher degree of digital learning. And that's exciting for health professions. And I think it's something that we'll be able to utilize perhaps in not too distant future. So that concludes our presentation. We have a few minutes for questions. And I do see a couple of questions in our chat. I'm just going back to Lynn. Some of y'all had some trouble with the polls, which is totally fine. I think we got the gist of our the feedback there. But does EHR Go include dental providers? Yes, it does. There are a dental clinic, I believe, in there. And again, the nice thing with EHR Go is they are super receptive to hearing about other ways they can enhance and enrich their cases. So we have offered feedback to them because nutrition and dietetics used to be a program that was primarily for nursing and physicians, but it was really nice to see over the course of a few years them growing their interprofessional audience. So I do almost positive that dental providers are in there. Is EHR Go an application available for free? No, I do not believe. It does require a subscription. I just don't know exactly how much, but they do work very, very closely and very easily with us as Rutgers faculty because there are a number of health professions that are utilizing it. So I don't know the actual cost, but it is, it's not available for free, unfortunately. We do OSCEs in dental hygiene, so I will look into this. Yes, Lynn. Yeah, we definitely, we've done some interprofessional work, kind of events with dental hygiene and our dental students across the street, and so I can absolutely attest that OSCEs are used in dental education. And the nice thing is this is just one style of OSCE. Other health professions like dental will create different styles of OSCEs. They might have one room which is testing one skill that the student needs to go through, and then the next room will be a completely different skill. So maybe it's a different diagnosis and maybe 4 or 5 different rooms. So, and med school does the same thing. So we chose to just focus on our nutrition focused physical examination. But if you do the research, you'll see that other health professions use the same kind of skill training in different designs, different ways to design it. Oh, thank you, Jen, for chiming in on the cost. Pharmacy, yes. So Les is saying we also use EHR Go in the pharmacy realm. We have converted to a site license model. So I'm not sure what that means, but I think that's based on the Rutgers license. So perhaps that is also based on the Rutgers license. Okay, so maybe that cost is based on a Rutgers license. That is what pharmacy is also taking advantage of. Okay, thank you for commenting on that on Jen. Jennifer Tomesco is also in our department and our program director. So thank you for joining, Jen. Any other questions? It's great to see educators from other RBHS and Rutgers education, and also other health professions educators here. I know we're just a subset of a very large community that's coming to today's program. So I really appreciate you all attending our session. And we provided you our emails. So if you have any questions or you would like some more insight on any of these strategies, or please feel free to reach out.
Thank you.
Enjoy the rest of your day.